Okay, we are live here. Hang on one second with us on Levels Without Limits. I am your host, Amanda Marino. I'm trying to go live on Instagram. Let's see if it's doing it. All right, we're live everywhere. Good afternoon, my old friend and new friend again, Dr. Phil Scuderi. Thank you so much for being here on Levels Without Limits. We're here on Facebook, Instagram, TikTok. I'm not TikTok, LinkedIn, and YouTube.
All
So
right.
Except for TikTok. So we're on all of the platforms right now, so people can reach us everywhere. We go back, I used to work, you used to bring chiropractic services and certain services into treatment centers probably a decade ago when we met.
Yes, that's right.
So if you'd like to introduce yourself to people, and now we've rebonded and I've had lunch with your lovely wife, with Sarah, and, really got to get to know her heart. She's a beautiful soul too. You guys are great people.
Yes, thank you. Well, first off, thank you for having me on here. And I know we have some cool things to talk about. And yes, I did meet you about 10 or so years ago when, as a chiropractic physician, we focus primarily on, injuries, the spine and physical therapy. And then when I heard about, addiction and chiropractic, I thought it was like hokey pokey. Like, what is that? What does an adjustment have to do with addiction? And then what I learned is that, the brain's reward center is like the number one reward center, but the number two reward center is in the limbic system is the spinal column, is the spine. And I thought it was really interesting. And then it led me to get an addiction diplomat and learned a lot more about it, and then work in treatment centers and meeting, people like yourself. So what you guys are doing now is really great.
Yeah. So tell people about you and what you like. What do you do now? And like you have two practices, Delray and Jupiter.
Yes. Well, Palm Beach Gardens. So I took my my basic knowledge of chiropractic and whatnot, and then we were working with enough treatment centers in the Delray area that we opened up our own office down there, and we had like a area of it as a gym where patients could, instead of going from treatment centers to like LA Fitness, because what's at LA Fitness or nothing. This was nothing bad about LA Fitness, but these big box gyms, they didn't really have a lot of people really watching the patients when they went and worked out. Sometimes they would wander off and do something else. Sometimes they, maybe get their hands on some things that they shouldn't do. And I think some of them would leave and go get their hair cut. So anyway, we created an environment, a sober environment for them to go in Delray Beach, work out and get, our care. And it was great. We did it for about a year or so. And then, insurances change and they made it more difficult. And we kind of segued in from the gym being a place for recovery patients. More so we made like a med spa out of it, to treat people of all walks of life,
And the gym, I have to say, in Delray is that whole facility is stunning. It's a beautiful facility. It's very, the tables are nice. The adjustment tables are nice. The gym is beautiful. And then you offer like our topic today is the GLP-1 medications and hormone balance, where it relates to addictions, health, mental health, and some of the stigmas that are out there about it. Like you and I have connected on that there's a thing that if you are a person in recovery or you struggle with certain mental health issues, that like you should not take certain things,
right.
Such as testosterone. So I know that you are passionate about male. We're starting a males kind of part of our program together, and men are struggling with low testosterone and then thinking they can't like take a doctor prescribed dose.
Correct. Well, or there's feelings of like you shouldn't do that. So, all right, you bring up a good point. Let's just dive into that. So, the part of the business that you're talking about, the aesthetic side, it's called Basis Aesthetics. So we focus on like all the rejuvenation things like lasers and facials, but also hormone replacement therapy, peptide therapy, and then of course the weight loss peptides or medication. So hormones. So here's the deal: if you take your average like 40-year-old man, and let's say he's not in recovery, and he just presents to a doctor with symptoms of like brain fog, fatigue, not feeling like the energy and his libido's down, his recuperation. Okay. So he gets his blood work test we put on site, fills out symptoms and surveys and whatnot. Anyway, so we get his testosterone back, and let's say the normal range is between 300 to 1200. Okay. 300 is you're still normal, but you're just low. Or I'm sorry, you're not considered low, but you're suboptimal. And then 1200 is if you're like 19 years old. Okay. So this guy, remember, he's not in recovery. He's just a regular guy, and his test comes back at 400. Okay, that's what we call suboptimal, and we can actually give him a prescribed dosage through our medical doctor, our nurse practitioners, or PAs, monitor this. It's a weekly injection, or it can be broken up into smaller injections throughout the week. So this is a very detailed, monitored, low dose, bioidentical hormone replacement therapy program. So take the 40-year-old guy that's just been drinking for 20 years or doing drugs, who's wrecked his endocrine system. And here he is. Now he wants to get sober. He goes through a program like you have, which is great. And he's doing counseling. And by the way, you got to have your foundation in place. You got to have your group, your counseling, your mental therapy, all those things that are so important, as well as other things like exercise and diet. We'll talk about that. But let's say he gets his blood work checked and it's 305 or 320 or 400, same thing. Well, don't you think that for this particular gentleman, to stay on a track of being sober, it would be a good idea to, help him out with, like you said, the same doctor prescribed program? Like, why should it be any, like, why should he not be able to benefit from that? So that's where we got to break some walls down about helping people, and women as well, that have really hurt their hormones, by getting themselves more optimized to lead them to help them stay sober.
Yeah, no, hormones. I mean, listen, I'm 44 and I'm in the era of, I'm no longer having children and I'm in perimenopause. And like, I say to all my girlfriends that understand where I'm at, I say, I don't know how women survived for centuries without anything or any support. Like, they were sent to psych wards. That's what happened. And then, we're miserable. And so our hormones play a huge part in our mental health. And it is real, and will affect you. Like, what, like you said a few of the symptoms. So what would be the symptoms for someone for like they're feeling a certain way as a male? Say they're coming in to change their life, whether it's a recovery or their mental health, or they just want to get their levels checked. Like, what would they look for in themselves?
Similar for men and women, but for men specifically, like, number one is brain fog. Just that feeling of like, it's 2 o'clock. You just had lunch, you drank a coffee, and you're just like fatigued, you're tired, you're just not thinking clearly. So it's actually a mental feeling. It's not so much like men don't come in to see us and be like, I just don't want to be with my wife as much, or I can't, have gains in the gym. Yeah, that's part of it, but it's usually a psychological component. I just don't feel myself. I don't have that vigor, that something's not right. And then of course, difficulty sleeping, other things as well that lead to it. So that's why the simple blood test is really, and it's a very detailed blood test. It has 63 markers and it gives us a lot of information, but it's the symptoms that we see commonly for people as they age.
Yeah. And thank God for these things today, right? Just to make it a little easier for everyone. So we touched on before just some of the research that we found out about certain things. I'll let you share about the research that you said started in 2022.
So, okay. So what I think what you're referring to is now one of the other things that is beneficial are these, and they're extremely popular now, are these GLP-1 medications. GLP stands for glucagon-like 1 protein. It's basically a peptide that it's in your brain, it's in your gut, and it helps us with like our cravings and our hunger and whatnot. It's actually been around, not the medications that we use now, but it's been around for about like 17 or 18 years. And they were named different things. They were basically like obesity and diabetes drugs. Well, around, I believe it was 2017, that's when Wegovy came out, or those. And by the way, so you have semaglutide and tirzepatide. Those are the compounded names for the pharmaceutical names, like Mounjaro, Wegovy, Ozempic. These are things that you'll get a prescription from your medical doctor. So let's talk about this for a second. If you have diabetes or pre-diabetes, those are prescription medications that you get from your doctor that would be covered by insurance. Okay, so if someone comes in to see us and they have that, I'm like, just go through your primary care doctor. Fine. Right. But if you want to get a prescription for that without having insurance, it's very expensive. That's where the compounded versions come in. Okay, the semaglutide, the tirzepatide, we prescribe those. Clinics like ours, it's a lot more affordable. You can even do weekly injections where you go on site to a place like ours and you can get weekly injections. We can dose it out properly. Some of the things that you'll hear that are bad, or some people are using too much of it, using it for too long. But every drug is like that. Every drug can be abused and misused. But so what they're finding is not only is it going to help you lose weight, is it going to help you control obesity and diabetes and whatnot, but what about for addiction issues? They're all similar pathways. So they will help reduce those cravings. You know what I mean? They'll help people drink less or not have the urge to go smoke or do other things. I'm not, again, saying that this is like an addiction drug. Get on it, and you won't, but it can really help people.
Yeah, it's not a cure-all, but it is another tool to add to the kit. And then there's this new supporting research, because they're just starting to research it in 2022. Yes. I mean, I've heard a lot lately. It's like a very hot topic. And I think some people are willing to try it, like in desperation, like are willing to try whatever. If this is something that could kill two birds with one stone or multiple. I know when I've taken it, I have. I don't care what anyone thinks. But what I have, it literally, I don't want sugar at all. And like, I'm someone that like loves sugar. And so when I was constantly traveling, that's when I was really struggling to keep like to eat right, or to eat healthy. I don't say right or wrong. And it really just helped me to make healthy choices, because when you have to be mindful about what you're going to put in your body when you're not really hungry, I make healthier choices, and I don't want any sweets at all.
Right. Well, you brought up a good point about, I don't care what people think, see, that's the kind of the issue. It shouldn't be viewed like that. Like, you don't have to be obese to be on these medications. You don't have to be overweight. It just, if it helps you with a craving, who doesn't eat dinner sometimes and want to have a piece of pie or something? Well, if you know anything about calories, a piece of pie may have more calories than the steak and baked potato that you ate. Like, it's a crazy amount of calories. And then you think, you ever been on a treadmill and like 20 minutes into it, you're like, I burned 140 calories. That's like one chocolate.
What is this?
It's like, that's crazy. So anyway, if these things help you with your cravings, with control issues, with feeling full, okay, like, what's the problem with that? You know what I mean? So I think if prescribed correctly, it can help a lot of different people.
Yeah, well, I had a friend of mine, the online world is so rough. She has a massive following, and she for her was not comfortable in her body, and got on, and was promoting and working with a doctor on Instagram, and she was catching so much, like, we don't need that, da, 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 da. But for her, she was used to like being in a certain kind of body, and then going through perimenopause, that changed for her. And so she was being shamed because she chose to go on this medication because she wasn't obese, and I just think that's, I mean, of course, online people want to say all kinds of things, trust me. But I think it's very similar. The judgment of the GLP, those, and the hormone replacement, like these things that have so many benefits.
Right. Well, it's funny, Amanda, that they help people that are not in recovery. Okay. Think of it that way. So if it can help people in recovery, you know what I mean? Like you said, if it's another tool in your toolbox to help you stay sober, whatever that is, whether you're in a 12-step program, whether you go to meetings every day, whether you have your support groups, whatever those things are. But if it's also exercise, which is that's probably the one thing that should continue to be talked about all the time, because exercise is such a good way of just getting rid of like just that frustrated feeling in your body, but also releasing natural hormones that help you feel good. And then it's healthy for your whole body and your your self-confidence and whatnot. But anyway, so all these things that are good, well, hey, if I can balance my hormones or optimize my hormones and feel better and lose weight and feel good about myself, and if, have a better relationship with my spouse, so then wait a minute, I can also take a GLP-1 potentially that's going to help lower some cravings. I feel like it's a lot of things to help somebody. And you know what? Nowadays, everybody needs as much help as we can get, especially people in early recovery or late recovery or any stage of recovery.
Yeah. And really all mental health, and all, I mean, and if like, even say you are someone that, you just hit a certain age and then you start to feel different in your own mind and your own body, that's like, go get a full blood work. I definitely recommend it.
Yeah. Well, we're seeing, you bring up a good point. So for men, back to men, it used to be like 40. Like, if someone came in to me, they're 35, like, wait till you're 40. Well, guess what? We're seeing 30-year-olds. Low 30s, 31, 32, sometimes late 20-year-olds. They're coming in with symptoms. We're getting their blood work. And honestly, I'd say 8 out of 10 people have suboptimal numbers, low numbers that we would see in a 40-year-old and a 28-year-old. And it's kind of scary, and it's another bigger picture of, well, what's causing this? The foods we're eating, what we're drinking in our waters, let's say, additives, and then stress. And there's so many things that could lead to this,
I know we've had a mutual client, Could some of it be young steroid abuse?
Oh, absolutely. Steroid abuse will crash your natural ability to make testosterone. Obesity, people that are just overweight and they don't think it's a big deal, but it's, having too much, fat in your body. It's an estrogen producing environment, and your testosterone is going to go down, or it's going to be affected. So there's a lot that could explain like why we're at this level. But the good news is there's also a lot of knowledge, and there's ways of helping this.
Yeah. So what if someone is watching and they like they've only heard of testosterone as being like, abusing it to get massive muscles in the gym, right? And they want to know the difference between, like a clear difference between going and getting it like medically. Because I think that we touched on it, but I just kind of wanted to dive a little deeper into that.
Yes. It's probably something I take for granted. So you're right. A steroid cycle, first off, it's illegal. Okay. These are illegal things. You just don't get at a store. You can get it online, possibly. I get it from somebody at a gym. But my point is, a steroid cycle is like, these are testosterone or testosterone derivatives that you're taking multiple times in a week. Usually these guys are stacking these medications, and they're doing it for a long time. There's no blood test. There's no cleanliness. There's no purity getting these medications from a lab or, like a good right. Pharmacy or whatnot. Okay. Where a hormone replacement therapy program is, you're coming in, you're filling out like you're a real patient. You're filling out your paperwork, which is going to have symptoms that you're feeling. Next thing that you're doing is you're getting a physical examination. They did just change a law a few years ago that you can actually do this physical exam via telemedicine, but you're speaking with a nurse practitioner, a PA, or a physician.
Okay. Lastly,
you are getting a very detailed blood test, and then the doctor will take all three of those things, look at it, look at your family history, what your symptoms are, what your blood work looks like, and he'll come up with a program. So here's what's cool about like our office, for example. A lot of HRT clinics have, for men, they'll have 200 milligrams of testosterone a week, or 1 milliliter a week. Fine. That's like cookie cutter. We don't do that. We will recommend somebody gets on, or the doctor will, I should say, will say, start them at 150 milligrams a week or 120, whatever number it is. And then we'll test them in about 4 weeks, 6 weeks time. And if their testosterone is improved, but it's still kind of like not really where they need to be, or their symptoms haven't improved, he can go up, or sometimes they'll go down, because some patients are very, they don't need a lot of testosterone to make their rates, to make their numbers go really high. And some need the full 200, but it's a very medically followed program. It's safe. So here's another thing. What if someone said, well, it could cause, problems or your issues? Well, remember, we're retesting their PSA. We're retesting their liver enzymes, their cholesterols, their blood chemistries, their hematocrit. We're looking at everything. So if something was wrong, we would see that there was a problem. You know what I mean? And when we see nothing, matter of fact, you see improvements when they're on HRT. When you see blood panels improve over time, that's what's really a great thing to see.
That would be a great, that's a segue to another great question. So like what are some of in both categories that we've discussed, or all of them, some of the false truths? Like there was for a while people saying that that the trizepatides, semaglutides were causing like all these health issues in people, and they were getting hospitalized, and like you were hearing some of that go on. I really haven't. I'm sure there's some cases maybe along the way, but I know a lot of people that have done it that have had no issues besides stomach aches, right. Or trouble going to the restroom, but besides that, like I haven't heard of other things that were harmful. So, and then also with the testosterone, you're saying you're seeing better blood results. Like what do you see with both?
Okay. So let's go. You brought up the first one, the GLP-1. So first and foremost, when you get your evaluation, they do ask you specifically, have you had problems with your pancreas, your thyroid? There's a few glands that we have to be really careful that, if there's a family history of certain ailments, but there's very few things. So as long as it's prescribed safely, and like, for example, we prescribe semaglutide typically just 0.1 ml. It's a very small amount. Yes. Most patients will say, I felt something, but not a lot. Very rarely will someone get sick from that. Some clinics I've seen will start them off like a half a milliliter fast. So we don't do that. But again, back to what I said originally about like some of these medications could be misprescribed, or the person's not taking it the right way. So yes, it could lead to, gastritis, like you said, stomach problems. Remember, it slows down digestion. So in very rare cases, can you have like real digestion problems? Again, these are real things, and that's why you have to go to a legit place. Look, I know people that are getting online. I mean, people like that are my friends. I'm not mentioning any names. Like, I mean, they're not going through a doctor. So what are they taking? That's what I try to remind them. Like, guys, stop being cheap. Just go get yourself checked out. Like, the stuff that we get is real. Or go to your primary, but don't just order it online. So you gotta be careful. Then with testosterone, the only thing that we would ever see if someone did too much testosterone, for example, is their hematocrit, the thickness of their blood will get a little too thick. So we would recommend like doing what's called a blood dump, or where they give blood.
Donate blood from the
once every 3 months or so. But like really, like if the testosterone is too high, we reduce it, and we keep an eye on all these other markers. Again, I don't remember seeing anything that would be alarming to say we need to stop this. If someone has a PSA, we did have one patient where he was on HRT, he's doing very well, and over time his PSA started increasing. So we got him off HRT. We referred him to his urologist, and eventually he actually did have a problem with his prostate. But he came in later and he's like, "Thank you guys so much for checking my blood work to see that something." It was totally unrelated. I have a family history of it. I've had problems in the past. But anyway, he was very appreciative that we were actually monitoring it. And then when it got to a point where, hey, go see your urologist, let's get cleared first, or to either get back on this or to not do it. And that's one out of thousands of patients so far.
Yeah, that's the key, is like and so like the blood work that you say I do annually, like at my annual, doctor. That's one thing. Like I know there's a lot of people that avoid things, but like I try to make sure I'm proactive. Like I had my first mammogram way before 40. I had my first what's the gut one?
You had your
before I don't want everything early. I want to know. I want to handle it. Like I'm opposite. Like I know so many people that will just avoid.
Sure.
So if I go get my annual blood work, what is the difference like that say your team would do as far as a deep dive into the hormonal? Because I know that they just kind of hit the surface unless you request. Like when I was starting to feel the symptoms I did, I requested from my OBGYN, can you do extra in the hormonal area for me?
Yes. Okay. This is your best question so far. Super frustrating with something we see too. We'll get a patient wants to come in. He was like, "Oh, I just saw my primary or my OB if it's a woman, and I did a full panel." I'm like, "Okay, here it comes." It's literally like CBC, which is red and white blood cells, thyroid, and like sometimes that's it. No hormones, or maybe one hormone. It is very, like, I don't want to say inadequate, but for what we do. So again, let's go back to what are we looking at? So we're looking at kidney function, liver, your A1C, which is like your ability to process sugar, so like diabetes and glucose, all the hormones, testosterone. Then we'll break down testosterone free and total, estrogen, DHEA, progesterone. I mean, we're looking at these things for men, PSA, red and white blood cells, and a lot of this stuff that I just mentioned is not like IGF-1, which is the ability of your pituitary to make growth hormone, which is important. We rarely prescribe real growth hormone, but we'll prescribe peptides that can help raise that IGF-1. I don't think any primary care doctors ever even test for those things. So it's a little bit frustrating that they don't test for more things that can show what's going on in your health.
I know. I mean, we could go down the whole loophole with a whole rabbit hole with the insurance companies, but like if someone were to come to you, like they would get like a very full, robust workup, not just these basics that really don't tell you much. I always get, because I don't need a lot of meat, but I also drink. I mean, I eat turkey and chicken sometimes. I had chicken with you the other day at lunch, but I always get very like a little low in the protein, and they're like, you're either drinking too much water or not enough protein, and it's both. I drink a ridiculous amount of water. I actually drink too much.
Okay.
And I don't have enough protein, but those are usually what's off on like my basic blood work. Okay. But no, it was really important. I had to specifically ask my doctor to get the deeper dive into my hormones. What are some of those that you just are? Those are all the ones that you mentioned that are important for the hormones.
Yeah, I mean, in men and women. So like a good thing for, let's say for women, for example, testosterone is very important for women. It's at a lower dose. So for example, women's estrogen is here, their testosterone is here. Men are like the opposite. Their testosterone will be here, but men need estrogen as well. So getting a a full panel of these hormones is, and remember, it's a snapshot of your health. You just do it. We typically have patients come in the morning and do a fasted blood work. That way, we're going to see what their true glucose is. We're going to see what their A1C is. It's not going to affect their cholesterol because they didn't eat anything. There's a fat in it. It doesn't affect their liver enzymes. So we got a good picture of your health, by you being fasted. Now, you brought up one thing, Amanda, about protein. Protein, super important. Okay, so let me give you like my 60-second diet tip that it's so easy to like understand. Of course, to do it is not that easy. But anyway, when it comes to dieting or like what you should eat, I heard this from actually Chris Bumstead. He's a professional physique bodybuilder and 7-time national. I mean, really an amazing person. He's got 25 million followers on Instagram. But he was like, look, get your base, your foundation should be protein. So for a guy like my age and my size, I weigh about 220 pounds. I want 220 pounds of protein. I mean, 220 grams of protein a day. Fine. There's your base.
Yeah.
Then what about fat? Everybody should eat low fat for the most part. I mean, unless you're super skinny, like you should eat low fat. So practice eating low fat. Like, and he's getting sauces on the side, not putting a bunch of butter on things. Fine. Well, what's left? Carbs. Carbs are energy. So if you eat not enough carbs and you're hungry or you're not energized, then you want to add some carbs. If you're eating too many carbs, because at the end of the day, I'm not the end of the day, at the end of the week or whatever, you're looking and you're not losing weight and your pants are too tight, then start taking away some carbs, especially at night. Because remember, when you eat carbs at night, you're not burning them. They're going to go right to get stored in glycogen and then convert to fat. So I loved hearing that. So for a woman like you, 130 grams a day of protein, but that's important because if you're not eating 130 grams,
I'm not 130 pounds.
I know. Well, okay, but
I'm 5'6", and I'm like, I have,
They say either your body weight in pounds or your body weight goal. Okay, so that's another thing too. So if I want to weigh 200 pounds, 200 grams of protein a day is a good foundation. So I just like doing that because I felt like that's easy to understand.
Yeah, that simplifies things. I definitely try. I have to obviously make a conscious effort. I eat seafood and I like ground turkey. I tried to eat beef and pork again after not over a decade. I just can't do it. Yeah. It just isn't for me. So I also do like these little Orgain.
That's what I was just going to say. Those drinks are called RTDs, ready to drink proteins.
Yeah.
I don't know what brand it is. I mean, there's some that are better, depending if you go whey or vegan, but I'm telling you, to be able to drink 20 or 30 grams of protein, boom, 5 seconds, and you're like, that's a good thing rather than skipping a meal. I love those.
Yeah, no, maybe it's because of I can't eat until lunchtime. Like I don't purposely do this.
Right. Yeah, what's called intermittent
fasting. I did at one point, I think intentionally tried it. I don't weigh myself. I don't ever have like a goal weight for me. It has never been a good place for me to go mentally. It's good for me to just go how I feel in my body and how I feel in my clothes and things like that. That's what's most important to me at this phase. But yeah, I definitely have tried all the different things, but now I'm not hungry till 12. So this is the first thing I can get in my body, even if whether I work out or not. One of the a pre-made. I get it on Amazon. I always have them stocked because then at least I get something nutritious in.
It's easy. It's fast, and you don't want to have to stress about preparing meals because it can get stressful.
Yeah, I've done the containers. I've done the macros. I've done all the things, and I'm like much more content just right now. With no rules, but I focus. I have my bachelor's is in alternative medicine. So I do a lot of nutrition courses. So I have a lot of good background on that. So just focusing on eating what feels good makes my body feel good.
I love it. I love what you and Sarah are doing too, by the way. First off, even just this, which is getting good information out. I want people to know too, that are in recovery, it's okay to want to get your hormones checked or get your blood work checked. It's okay to, if you're thinking about losing weight, if it can benefit you and you're not going to think about drugs and alcohol as much, then that's a no. Like you said, it's a win-win. I feel good about talking to people about these, about asking your doctors, or about looking into options rather than just feeling like I shouldn't be talking about this because it's bad or it doesn't go in line with recovery, because it does.
Yeah, I'm super anti-shame, anti-stigma. I mean, I used to be a very harsh mentality, black and white, and I hurt a lot of people. I lost it. I shared with you, I lost my best friend in 2016, and like I would pay anything today to have her alive and on a medication, than not be here. But I just didn't know what I didn't know then.
Right.
And that's why I continue to open my mind, and I want to bring, people like you on here to add these pieces of information for people. Like there's a lot of garbage, I believe a lot of garbage content online. And so I've taken it kind of as my personal responsibility to interview people that can bring great information to people that I'm connected with on all the platforms and really just get it out there. So the one thing I did want to ask more about was, just because we've worked cases of this before, is someone that is abusing, say they are abusing testosterone, and then they want to titrate down and want to, get to a healthy level of taking it or not. Like, can you touch on that?
Yes.
How can somebody do that? Because that's a big problem still.
Yes, I like the word you used by titrate. So similar to alcohol, people that are in, they before they go to detox, you don't just stop them drinking, because they can die literally. So they wean them off. So it's a good idea to probably, when it comes to, unfortunately, yes, some people do abuse steroids and they abuse testosterone and the derivatives, and it's not a good thing, because it will lead to aggression. It's not good for your body, especially depending on your age. If you're in your 20s, that's one thing, but if you're 40s or 50s, and if you're taking too much of these anabolics or androgenic steroids, I mean, you're gonna have problems. It's a guarantee. But yeah, so we'll get them in, and hopefully we'll get obviously an updated blood work, but hopefully they'll be honest with us. But the good thing is, when we tell someone, hey, your testosterone is 9,000. I mean, remember, it's supposed to be between 300 and 1,200, and it's like there's no hiding from that. So what we would do is we would get him on something to reestablish his natural ability to make testosterone, and give him probably a low dose, but we would just like monitor him probably week to week. And if it doesn't start going down, semi rapidly, then we know, if we have a situation where they won't stop, then we can't help that patient. But we can take someone that's using steroids and bring them down without a super crash, not cold turkey, get their natural ability. So things that help some patient, a male, naturally make their own testosterone, which sometimes we have people in recovery that don't want to be on testosterone. Fine. You get on something called Pregno, which is HCG. There's something called Gonadorelin. There's something called enclomiphene or Clomid. So these 3 or 4 medications will help your body naturally make testosterone. They're not steroids. They're very safe. They're actually fertility drugs. They do work, and they're not as good as like real testosterone, which is, remember, I'm talking about bioidentical testosterone, but that's something that we can do to help somebody that doesn't want to, just go cold turkey.
Well, I have another question now. What is the difference between bioidentical and the actual thing?
Okay.
Because I have done both, and I'm not sure that I even know the difference.
Okay. So the testosterone that's typically prescribed by our medical doctor, it's called testosterone cypionate. It's is it the exact testosterone your body makes? I don't know exactly the answer to that, other than I think it's either the exact thing or like as close as it gets.
Well, not just testosterone, like all of it, because I know they make bioidentical stuff for women too.
Yes, they do. They make biomedical.
Yeah. So the
estrogen, but I think sometimes, or back in the day, they used to make like these like gels, like these andro gel or whatever, that for women, and it's like not real testosterone, and it can be dangerous. Same thing. So it's basically just the difference between synthetic and something that's bioidentical. So it's more like what your body naturally makes, as compared to something on the synthetic side. Unfortunately, steroids, like you'll hear about, like, words like Dianabol, Deca. These are all like derivatives of testosterone. They are not naturally made by your body. Yeah.
Okay, that makes sense. That's because I'm sure a lot of people are like me, like unclear, on the difference.
Well, if you're being prescribed by somebody, a doctor, you want to make sure that, hey, are these bioidentical hormones? That's a simple question you can ask.
Yeah. So recently, Sarah and I, Sarah put together this idea, and we brought it to Dr. Scuderi and his wife, and for them and their team to partner for men's mental health. So
it just froze really. Do you hear me? Because you just the screen just froze. Your screen did. Hmm. Hello. Hey. Oh. Okay. I didn't know what I was like. It just froze and your power went off. Okay. Oh my God, what a pain in the rump. I didn't, that's, yeah. You know, it's funny. I have those battery backups too. And like half the time they don't even work. The power goes out, everything shuts off. I'm like, great. Those things are supposed to, oh my God. Well, we got a lot of content. I mean, yeah. Okay. Yeah. Wrap it up. Okay. You got it. So, so call me. I'll be in front of my computer. Just call me back or get back online whenever you're ready. Okay. No, you're fine. No problem. Okay. Bye. Bye.
Still live. Okay, it's still
Okay.
live, or it's just picking up where we left.
Okay.
Okay, I had a huge boom of thunder and my power went off. So, but here we are. We're back. Oh, thank you, Lucy. I was frozen. No, I was gone. My internet completely went. The whole power went out for a minute, but we're good. So we were touching on the last thing that we really wanted to talk about was we're partnering for men, specifically. So we have Dr. Scuderi to help with hormones, anything, all the if you want to list all the things that you can do for men that are struggling with anything.
Yeah. So like we talked about previously, like starting out with a good blood work panel, I think would be a great thing for, whether you're in recovery or not. But anyway, the blood work panel, then, what kind of symptoms they're experiencing. Obviously, I have an office in Palm Beach Gardens in Delray Beach, Florida. If there's a physical, injury going on, we obviously treat those as well. And sometimes, you got to remember, somebody could have sustained an injury years ago, which led them down the rabbit hole of Percocets and Oxycontins and all that stuff, which is a whole other issue. But so we can help people, while they're doing your program and doing the right thing for themselves and doing all those things that are so important, getting their hormones optimized, getting their their blood work balanced, if they need to lose some weight, and at the same time, get rid of some, or help with some of these, reduce the levels of cravings that they're having anyway, these GLP-1 medications. So I think we definitely help a program like what you do and help the patient.
Yeah, because we, everything that we do is individualized, and we've already worked a number of cases together. I think that's where adding you into it, having Dr. Hutman, be available for any psychological, having Dr. Morales available for anything, psychiatric, you for anything with the body, and some of these medications that have been discussed today. And then we have two coaches that are also personal trainers and who had their own body struggles, being able to work with them and really having this collaborative team put together of kind of making sure all the boxes are checked with the mental health, with the addiction, if there is that, with the hormones, and just kind of putting it all together and being this collaborative team really could help someone feel better.
I think is what we did, kind of the analogy before. It's like, imagine something breaks in your house and you're like, oh man, I don't want to call somebody, or no one's available, I got to fix it myself. And you open up your toolbox, you have one hammer. But now imagine you have a full set of the best tools and you're set. And that's what I think you're doing. You're setting up this awesome toolbox with all these things to help. And it's an awesome thing. It's a great team.
Yeah. Collaboration is everything. I think that even people that do the same thing that I work with, I just think there's so much room for collaboration. There's, the men, I've heard it so much with young men, with older men, all men, that they're expected to, be a certain way, but then also show feelings, but they're not supposed to man up. And it's really, really hard for some men to open up. And then I'm close to a lot of my son's friends, talk to them and try to support them too. And they're also shut down, so if you're a man who's struggling with any of these things, who's struggling at all, reach out, or for a woman too, of course, but we kind of are focusing. Sarah specialized, Sarah's a nurse, and she put together this idea for this to focus on men. Yeah. But you're not alone, and it's okay to share your emotions, and it's okay if your hormones are not right. That doesn't make you any less of a man. If you need testosterone replacement, all of those things are just really important. And then the judgment and the shame, if someone's doing something that works for them, or if you're doing something that works for you, then that's all you need to know between you and your team.
I love that. And you know what, Amanda, if anybody has a question, my cell phone is on my business cards, my email is on my business cards, it's on the website or Instagram or anything like that. You go to Basis Medical and see my Instagram profile. I answer questions there. Anybody has a question, I'm never going to be like, hey, you're not a patient of mine, I can't talk to you. I will talk to somebody as much as they need to. And if I can help them, great. If I can't, I would defer them, refer them elsewhere.
Awesome. Well, thank you for staying on.
Yeah.
And I will afterwards go on, the threads and put your website. And yeah, if you need any support, both of us, I think we kind of make ourselves available to people, obviously not 24/7, but if you're in the Jupiter area, Gardens area, Delray, he has great spots, great locations for all kinds of services. Definitely check it out. And thank you so much for taking time today. I know you're a super busy guy. Please tell Wendy I send my love, and I'll tell Sarah you said hello. She's on vacation with the kids.
Awesome. Yes, thank you. That was great, and I think we covered some really good content, and we got some things discussed. That was awesome. Thank you.
Awesome. Well, thank you so much for being here, and have a beautiful day. Thank you for being here on Levels Without Limits. I am Amanda Marino, owner of Next Level Recovery Associates and AmandaMarinoSpeaks.com, and just really appreciate having great guests like Dr. Scuderi on. Have a great day.
Thank you.